Aphorism number 73. As regards acute diseases, they are either of such kind as attack human beings individually, the exciting cause being injurious influences to which they were particularly exposed, excess excesses in food or an insufficient supply of it, severe physical impressions, chills, overheating, dissipation, strains, etc., or physical irritations, mental emotions, and the like, the exciting causes of such acute febrile affections. In reality, however, they are generally only a transient explosion of latent sora which spontaneously returns to its dormant state if the acute diseases were not of too violent character and were soon quelled, or they are of such a kind as attack several persons at the same time, here and there sporadically, by means of meteoric or telluric influences and injurious agents, the susceptibility of being morbidly affected by which is possessed by only a few persons at one time. Allied to these are those diseases in which many persons are attacked with very similar sufferings from the same cause epidemically. These diseases generally become infectious, contagious when they prevail among thickly congregated masses of human beings. Hence arise fever in each instance of a peculiar nature, and because the cases of disease have an identical origin, they set up in all those they affect an identical morbid process which when left to it itself terminates in a moderate period of time in death or recovery. The calamities of war, inunda- inundations, and famine are not infrequently their exciting causes and producers. Sometimes they are peculiar acute miasms which recur in the same manner, hence known by some traditional name, which either attack persons but once in a lifetime, as the smallpox, measles, whooping cough, the ancient smooth bright red scarlet fever of Sydenham, the mumps, etc., or such as recur frequently in pretty much the same manner, the plague of the Levant, the yellow fever of the sea coast, the Asiatic cholera, etc. Explanation of aphorism number 73. In this aphorism, Dr. Henneman has talked about sporadic epidemic and acute miasms. Acute diseases attacks human being individually because of some exciting causes. They are exposed having injurious effects. For example, excess of food, lack of food, chills, overheating, overindulgence in alcohol and sex, dissipations, strains, etc., or physical irritation, mental emotions. Such acute conditions are only temporary explosion of latent sora generally, which spontaneously returns to its dormant state. If acute disease is not so violent in character, then soon it will end. Acute diseases which attacks several persons, hence here and there at the same time by atmospheric or earth related influence and injurious agents, bacteria, viruses, etc. Here susceptibility is being morbidly affected, so only a few persons are affected at one time. Such acute diseases are called sporadic diseases. The acute diseases which attacks many persons with similar sufferings from the same cause at the same time. Such diseases are contagious when they prevails among thick congested masses of human beings. Such diseases are termed as epidemic diseases. Such diseases, all the cases have similar origin and affected by similar morbid process, and it terminates after moderate period of time in death or recovery. The calamities of war, abundance and scarcity of food are not being the exciting causes always which produces acute diseases. Sometimes there are peculiar acute miasms which recur in the same manner, so they are known by some traditional name which attacks a person once in a lifetime. For example, smallpox, measles, whooping cough, bright red smooth scarlet fever of Sydenham, mumps, etc., etc., or such as more likely the plague of Levant, the yellow fever of sea coast, the Asiatic cholera, etc.